Today we'll read about acute diseases and demonstration of an acute disease. How case taking is done in acute disease, we'll see the demonstration. So first let us understand a little about acute diseases. This will be done in an organon classes also. Acute diseases are given in the aphorism 72 and 73. What is an acute disease then? This is transient. Transient in the sense short lived. बहुत ही कम समय के लिए जो होता है उसको transient बोलते हैं. Self limited disease. Self limited in the sense it is cured with or without remedy. It cures itself or even it leads to mortality. Self limited disease. Rapid. Rapid means all of a sudden. It comes all of a sudden. It's not gradual. Morbid. Morbid means unhealth. Morbid means something unhealthy. So, what is an acute disease? It is transient, it is self-limited, it is rapid, and it is morbid. Derangement of the vital force. Now, what is the tendency of acute disease? Tendency to finish its course in moderate time. It may be less, it may be more, but actually in moderate time. It finishes itself in moderate time. Now, if you see the classification of disease, this was given by our master Hahnemann, aphorism 72. He classified mainly diseases into two types. One is acute disease, one is chronic disease. In acute disease also, further classification is individual and collective. Now let us understand classification of disease, acute and chronic. Acute is of two types, individual and collective. Individual in the sense, if your hygiene is disturbed, if the rules of the health are disturbed, it causes individual acute disease. And another one is collective acute disease. Collective in the sense, again it is of two types, sporadic and epidemic. Sporadic is due to physical factors, meteoric, telluric, soil, water disturbances. So it is sporadic. It is in the sense at the same time at different places. When many people are affected at the same time but at different places, not in a same place. Sporadic, here and there, here and then. That is sporadic. This is non-infectious in nature. This is because of the disturbances of physical forces. Meteoric changes, telluric changes, those all changes cause sporadic disease. This is non-infectious. We have to remember this is non-infectious. Another is epidemic. Epidemic is contagious. It occurs at a same time in localized areas, here and there also. So epidemic is contagious. This is because of some acute specific infection. Sporadic is non-infectious. In epidemic also we have recurring, which recurs again and again, and another is non-recurring. You can have this in organon classes in detail. We are concerned with case taking in acute disease and demonstration of a case of a simple acute disease. You see, case taking in acute disease is given in item 99. Easy to remember 99. Here our master Hahnemann says that it is easy to take a case in acutes. It is easy to take a case in acutes. All the deviation or the phenomena are in the memory of the patient. Because patient has come to you for an acute disease, suppose 12 hours, 1 day. So he remembers all the deviations from the health. All the phenomena that has occurred upon him are in memory. So less inquiry is needed. You need to ask less questions. You'll be asking less interrogation. But you'll get all the information. So presenting complaints are very prominent. Patient can detailedly say each and every modality also. So less time is required to trace the picture of the disease. So acute case taking will take less time. And it requires few questionings because he'll be spontaneous, because he's suffering from an acute disease. He wants relief. So he'll be telling all the symptoms out. He'll be pouring out the symptoms, the patient. You need to ask only few questions. In aphorism 213 also, Master Hahnemann says in acute disease also, we have to observe mental symptoms along with physical symptoms. The patient will tell out all the physical symptoms, but we have to extract mental symptoms also. We have to carefully observe the mental symptoms also. Because in aphorism 213 footnote also, our master Hahnemann has a say that suppose the patient has come and of an acute disease and you get a simillimum of aconite. You are thinking the simillimum is aconite. But if the patient is calm, quiet, composed, and a very amiable nature, you cannot give aconite. Aconite patient is never calm. So here aconite will not be the simillimum. So here Hahnemann stresses to the fact in aphorism 213 that you have to observe the mental symptoms along with the physical symptoms in acute diseases. So this is about acute diseases. It is there in 72 and 73. What is an acute disease? You can understand: transient, self-limited disease, rapid, morbid, derangement of the vital force, which has a tendency to finish its course in moderate time. And classification of disease, so that you know what is acute and what is chronic. And case taking in acute disease is very easy to take case in acutes, because the presenting